Well, we open our phone lines and email to any medical question you may have. It is our first Ask Anything of the season. Tonight, On Call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. So you, our loyal home viewers, are the producers tonight. Call in or email any medical questions you may have. This is one of our, actually this is the first of our Ask Anything shows. So it's your show tonight. It's Ask Anything. We need you to call in your questions. But first, let's take a look at this week's Prairie Doc quiz question. What's more dangerous? Number one, smoking cigarettes. 2, eating lots of butter and bacon. 3, heavy drinking of alcohol. Or 4, avoiding vaccinations. Viewers who call in the correct answer will be entered into a drawing to win a signed copy of our book, The Picture of Health. Each of my essays, originally written for this show, comes with a wonderful accompanying photograph by Dr. Judith Peterson. We'll announce the answer and the winner at the end of the show. Remember, you only have 10 minutes to get in your answer, but we will take your questions this whole hour. We answer your medical questions as they're called in or sent to us via Facebook or email. Call in questions to 1-888-376-6225 or send us an email to the address on the screen. Joining us tonight are Doctors Kelly Evans and Jill Kruse, both with the Avera Medical Group Brookings, my partners in crime. So let's talk a little bit about you, Jill. You practiced in Tyndall for a period of time.
Yep, I was there for 5 years, and it was an amazing 5 years of learning how to be a doctor on my own without...
But you were on call every other night. So you came to Brookings, and that was really it, wasn't it, the call?
And with a family. You know, if I had older kids, but having to, I had both my children when I was practicing there, and it got to be a little difficult to balance family life and
your kids are
work.
5 and
6 and 4.
6 and 4.
Yeah.
So that's wonderful. Mm-hmm. And Kelly, you have been here in Brookings for how long?
Yeah, I just moved back last year. I started practice in September, so I am pretty green to the job.
Well, you did your residency in Denver, and then you were chief resident.
Yep.
In Denver. That was a feather in your cap, don't you think?
Yeah, it was wonderful. I got to spend a whole year doing mostly teaching of medical students and residents, and whenever you're doing that much teaching, I really learned as much as I've ever learned.
Yeah,
so
see one,
it was a great,
do one, teach one.
It was a good year, but I'm glad to be back seeing patients.
You know, I was at Emory in Atlanta my years, and then I was on the junior faculty for 3 years. Well, that was a glorious learning experience. I enjoyed that so much.
Yeah.
Well, and so you two and 2 others are really the prime backup people for On Call with the Prairie Doc. You're the new Prairie Doc people, the backup people, and so we appreciate your support in many ways here.
Well, Prairie Doc's got to go sailing, right?
You guys, I'll tell you, and that's the other thing. This will go, no complaints. I don't want anybody, I hear a lot. It's okay, this goes. This was just a little reflection of a week and a half of sailing in the British Virgin Islands, which was really wonderful. So this is your show. 1-888-376-6225 is the call number. We need your questions. And so we'll start with the question about hepatitis C. Hepatitis C is one of those things that we didn't even realize until maybe 10 years ago, 15 years ago. So tell us a little bit about that, Kelly.
I've had a couple patients come and ask me about this, and I think it's because there's commercials on television now saying all baby boomers should get screened, and they mean folks born between 1945 and 65. And it's true, the CDC and a couple other organizations recommend universal one-time screening for Hep C, but why is that? Why, Hep C is a blood-borne virus. We think of it classically as something that we see in IV drug users, for example, people who have high, what we call risky behaviors. But baby boomers have a very high rate of Hep C. In fact, I think I read maybe 6 times the rate of any other age population. It's probably because despite we discovered Hep C, I think in 1989, but it was probably around for a decade or two before that, before we knew we needed to be screening the blood supply and doing sterile things with our medical equipment that eliminated a virus like that. And so probably people when they were young of that generation were exposed to it.
You know, just the blood transfusions, the getting surgery, all those things.
Yeah.
And tattoos.
Sure, yeah.
Until, I mean, we probably got it, hepatitis C from tattoos until 3 years ago or something like that.
Yeah. And I think this recommendation, you know, the commercial on TV is probably sponsored by a drug company that makes hepatitis C treatments.
Not probably.
Yes.
It is. And it gains them something like $80,000 for the treatment.
Right.
Which makes me skeptical.
Yes, understood, and I think it's good to be skeptical. To be fair, we do now have really good treatments for hepatitis C, when even 5 years ago, our treatments were not nearly as effective or tolerable. So
the treatment is curative, actually.
Yes, it's curative, and you know, our treatments as of 5 or 10 years ago involved a chemical called interferon, which made people essentially feel like they had influenza for the entire time they were on it, and it was 6 months at least that you were on it.
Pretty darn sick.
Yeah.
Well, but if you don't treat hepatitis C, except spreading it to someone else, no big whoop, right?
Not true, Rick.
Okay, let's get the...
So probably about a third, between 10 and 30% of people who have Hep C chronically will develop cirrhosis. And so Hep C cirrhosis is the reason for most liver transplants in the United States. People can get liver cancer from that. So I think it's actually a really reasonable recommendation to get tested, because even if you don't pursue treatment, it's good to know you have Hep C so that you can avoid alcohol, you can get vaccinated against other hepatitis viruses.
Still, it's like 1% that go on to get liver transplant. I mean, it's not...
Yes.
Now, that's very expensive.
Yes.
So it almost counters. Now, and we'll go quickly to the question because we have a question.
Yes.
Thank you for the questions. We appreciate your questions. Please call us, 1-888-376-6225. So any response, are you a skeptic like me, or are you a gung-ho person like Kelly?
Oh, I think it's always best to be in the middle. You know, one of the best advice I got from a doctor when I was in training was, whenever a new medication or treatment comes out, wait 5 years before you give it to your patients, wait 10 years before you give it to your family. By that time, you should know if there's any major problems or complications.
So it's an interesting issue. It's very spendy. It is curative.
Yes.
But my thought is, okay, I would screen higher risk people. I'm not screening every boomer.
Yeah, I try to talk about it with people because I think, exactly. And I think that's true about any screening test. I think it should be true about a mammogram, that you have a conversation about the risks and benefits of it.
And sometimes the benefits aren't as big as we really push them. A woman from Worthington would like to know, what are the symptoms of gastroparesis? How do you eat and live with this diagnosis? Jill.
Okay, so gastroparesis is when the muscles in the intestines aren't moving like they're supposed to. So the food kind of gets stagnant there. And as you can imagine, as more food's going in and nothing's moving through the digestive system, you can get bloating, gas, pain, and it can actually be very debilitating. I've had patients that actually had to go on tube feeding because they just couldn't tolerate anything orally.
Right, and so you give them food that's almost completely digested and slowly, little at a time. But the question I have is, why would they get this?
It's very common with people with diabetes, and then I think some is just an autoimmune response. So we don't know what causes all of it, but very common, and most patients I see it in have diabetes as the risk factor.
It's common. But it isn't. I know of one patient in particular who doesn't have diabetes, and it just happened. Is there any new medicines on the horizon that can start stimulating the stomach emptying in the small intestine?
Well, we do use the metoclopramide or Reglan, and that can help with meals to kind of stimulate the bowels to move. Yep. And I believe, oh boy,
There might be a new.
there's a new one. You have to ask Dr. Lapp.
Okay.
Yeah, I don't know about the new drug. There is something called a gastric pacemaker, and I plead ignorance beyond to have any other knowledge about it. But there is also, I think, an implantable device that sometimes used in severe disease.
Well, of course, you know that is an expensive and a risky procedure, and whether it really makes a difference or not. Sometimes they come out a little quicker than they should.
Absolutely.
Let's talk about commercials on TV that promote antibiotics, sexual function drugs, herbal supplements, hospitals advertising, doctors advertising. It used to be, before you were around, I mean, I was practicing in the 80s, and it was like in the mid-90s somewhere where they first came out with the first advertisement for pharmaceuticals. There was a resistance by the AMA, but somebody allowed it. I don't know who was keeping it from happening, but it has opened the floodgates. And right now, I mean, the commercials, a third of the commercials seem to be medical-oriented. What's your thinking on that?
Well, I'd say I think a lot of their money from pharmaceutical companies has shifted from drug reps talking to doctors directly to talking to patients directly. Now there's been the registry. Anytime a physician meets with a drug rep and is given anything of monetary value, that has to be registered, and people can look up and see how much has your doctor gotten and from which companies. So, there's some doctors that are paid speakers and will go out and promote and do educational topics on something, and then there's always sponsored by the drug that helps treat that said disease. And I know a lot of people have been kind of pulling back on that. A lot of clinics have been, say, we don't want samples, we don't want drug reps, we don't want to say that we're influenced by that. So they're like, well, if we can't influence the doctors, let's influence the public. And it's much easier to say, hey, go ask your doctor and hit this broad general public versus hoping this one doctor brings up, hey, you'd be a perfect candidate for this, why don't you try it?
Right. I really have a reaction to that. I mean, I totally agree with you. Kelly.
Yeah, I've always thought it's very interesting that there's a strategy of what we call direct-to-consumer advertising. And I find it surprising that pharmaceutical companies find it worth their money, but they obviously do. They wouldn't put that much money into it if it didn't work.
Crazy. It's a lot of money.
It is. It's a lot of money. So patients should be skeptical
When
as
they see
we
an
are.
advertisement.
Yes.
In case you didn't hear, exercise is good for you, but you don't have to be a marathon runner to get the benefits it brings.
The current physical activity guidelines for Americans is 150 minutes of aerobic physical activity each week. And those 150 minutes can be broken out throughout the week in increments of 10 minutes or more. So say, for example, a 30-minute walk one day, another day, or a bike ride for 30 minutes. So in addition to your 150 minutes of aerobic physical activity, Americans should shoot for 2 or more days to be doing different types of strength training, which usually includes some type of weightlifting, yoga, or body weight exercises to work all major muscle groups of their body. So physical activity offers a wide array of benefits. Typically, people are aware of the benefits it offers for chronic disease prevention. So it can decrease your risk for some cancers, heart disease. It can decrease your risk for developing high blood pressure, high cholesterol. But in addition to those preventative issues for chronic disease, it can also help improve your sleep, improve your mood, help with decreased feelings of depression, decreased feelings of anxiety, and really it can offer that social platform. If you are new to exercise or you haven't been physically active in the past, a first step I would recommend is maybe speaking with your healthcare provider or an exercise professional before you start, just to make sure you have that medical clearance. From there, my number one advice is always to find something you enjoy. If you don't like running and you feel like you have to force yourself to go for a run, it's probably not the activity choice you should choose right off the bat. And then third, it's really depending on what your current barrier is to being physically active, if you have one, it's kind of making note of what that barrier is. If you feel your time is what's preventing you from being physically active, if you can maybe scope out your week, if you can find, over your normal morning break or over your lunch break, you could squeeze in a 10-minute walk, start there. If you feel a barrier is one of your health conditions, or a health condition you might have, or you have a fear of being injured or aggravating, your joints when you are physically active. Again, speaking with that healthcare provider or finding activities that are safe and you're comfortable performing is a good place to start.
This is your show, and your questions are key to our show discussion tonight, especially. This is Ask Anything tonight. See if you can stump the stars here. Call in your questions to 1-888-376-6225 or send us an email to ask@prairiedoc.org. So how much of the visits with patients is spent encouraging them to exercise? I mean, do you find that you do that frequently, or should you do more of it, Jill?
Definitely could do more and do better. It's really hard. There's so many things that you try to squeeze into that 15 or 20-minute appointment. And, just hitting the major issues, what are they in for here today?
Right.
By the time you've talked about diabetes, blood pressure, cholesterol, you've kind of
used up
your time.
Yeah. Although my practice was like Kelly's, a lot of elderly people, and almost every problem that they have that they come in with, as opposed to yours as a younger population with the runny noses and the sore throats. But ours, an answer is many times exercise, not a pill, right?
Yeah. Unfortunately, people don't come in to see us about losing weight or exercise until it seems insurmountable. People are morbidly obese or have such bad orthopedic pain complaints that it seems impossible to exercise. But I love the advice that we just heard, which is anything is better than nothing. So trying to get the person who does nothing to go walk for 10 minutes a day, it's a first step that I think is accomplishable for people, and I always start with something like that.
I just read in the JAMA Internal Medicine Journal that they looked at couch potatoes versus weekend warriors versus fairly active people versus very heavy exercisers. And they found that the three groups after the couch potato had a 40% reduction in death rate. Quality of life is much better. Everything was better compared to the couch potatoes.
Yeah.
And it didn't take much. I really think walking is so very important.
Yeah. And I agree with. There are tangible effects to exercise, things like losing weight, maybe improving your diabetes, for example. But there's some less tangible things. When I see patients for depression, for example, especially that first visit, I really try to talk about exercise because there are so many benefits to mental health in addition to physical health.
Way better. And a walking stick, if you're an older person, get a walking stick. You can get, you can make sticks. Just go to the Runnings or whatever it might be and get some wooden dowels that are heavy, and you really need them to just see where you are in space. Can you speak about peripheral artery disease and possible treatments? What about the outcomes of the treatments? So treatments for peripheral artery disease.
So I would say the first is if you're smoking, stop.
Right.
That's the biggest thing, because if you're continuing to smoke, that's just going to keep narrowing those arteries again and again and again.
There's certain people that are like that. What is that name? That they keep on smoking. It's just burgers, that they really shrink the arteries just very, very fast. So first thing is quit smoking.
Quit smoking.
Next.
Watch your diet. Get exercise.
There it is.
Yeah. Yeah, and medical treatments for peripheral artery disease are similar to any artery disease, coronary artery disease, disease of the carotid arteries, which are aspirin or an antiplatelet agent and a statin medication, we know improve outcomes there.
Okay.
Peripheral artery disease in particular, there's good evidence for a graduated exercise program as improving symptoms. So even before you're talking about any procedures like stents or surgery for those arteries, graduated exercise program, which I think a lot of folks do in a cardiac rehab type setting, is wonderful.
Okay, but I would say that if you haven't any heart disease, if you don't have peripheral artery disease, my personal bias is statins are overrated.
Yes.
And that you have to treat something like 800 people before one is benefited. And the risks, particularly as you get older, are high. So if you haven't had a heart attack, you don't have peripheral artery disease, I'm not a fan of statin. I'm a fan of eating less and exercising more. You agree?
That's great.
Please talk about when I should bring my normally healthy toddler in when he develops a fever. What is a fever anyway? Is a certain level of temperature and emergency. Jill.
So a fever, by definition, is a temperature over 100.5 on at least 2 separate readings.
Oh, wow. I hadn't realized that there was that definition.
I learned that on my infectious disease rotation.
Okay.
So we were very picky on what was a fever and what we treated.
Yeah, not 105.
100.5. Yep.
Okay, so, and then do you bring a child in? When do you bring a child to the doctor? Does a fever mean you need to bring the doctor or the patient in?
Not necessarily. I'm a big believer in mother's instinct. If you say, you know what, I'm worried, that's a good enough reason to bring them in.
Yeah.
I would rather you be safe than sorry, especially with little ones. I really love it when parents bring them in and I can say, you know what, it's just a runny nose, it's just a cold, they'll be okay, but I'm glad you brought them in anyway. Because there's plenty of other times where, oh, well, we were gonna bring them in last week and then we end up finding, both eardrums are red and angry and about ready to burst, and these poor children have been suffering, and they didn't want to just come in because, oh, it's probably nothing. So never assume. We would rather make sure it's okay. My only pet peeve about fevers is when people say, well, my temperature is usually 96, so 98 is really a fever for me. That's not how it works.
I don't believe that either, do you?
No.
No, that's a good point. Please talk about, so let's say, do you think that the toddler may have a low-grade fever or a virus most of the time, but they're okay because they're playing, they're laughing, they're not crying, and they're eating.
Yes. So I can usually tell when I walk in the door if I'm worried about a child or not. So if they're running around the room tearing up things and pulling gloves out of the holders and blowing them up as balloons, that kid is fine. Yeah. If they're laying in their mom's lap and they'll barely lift their head or they'll just moan or whine, I'm worried about those kids.
A woman from North Sioux City would like to know why, when a person drinks wine, does their blood pressure go down? Do you have an answer there?
I don't have an answer there. If there's a physiologic reason why, I'm not sure what it is. Certainly, some people have a vasodilation effect with alcohol or wine. Generally
Do you see
speaking,
it as a danger there?
No, I wouldn't see it as a danger. Some people get flushed, for example, reddening of the skin when they drink alcohol, and that might naturally decrease the blood pressure a little bit.
What does vasodilation mean?
That means the blood vessels get bigger in diameter.
Relax.
So yes, they relax a little bit, and so you have
As the
millions
patient
of
does.
tiny.
Yeah,
precisely.
So what do the women's studies show about women drinking a glass of wine a day?
Just fine. Yeah.
Actually, I thought that the data said way more powerful in reducing coronary artery disease and vascular disease than statins.
And have it with some dark chocolate.
And then you are a winner,
Then you're perfect.
unless there's an alcohol problem.
Right.
And so if there's a big alcohol problem in your family or you have an alcohol problem, I had one patient who said, doctor, can I have a glass of wine a day? And I said, oh, there's data, you can have a glass of wine a day. And about 3 years later, the family called me and they said, she's drinking a glass of wine a day, but it's a 16-ounce tumbler. I mean, it's the full bottle, and you've got to tell her because she won't hear it from us. So I did. She was not happy with me. So I think we have to realize that there is an alcohol problem and there's danger for certain people. we're not promoting alcohol, but at the other side of it, there is some benefits of a glass of wine or two for men, or a beer or
Yeah.
is
Like
okay.
many things in life, moderation is good.
Yeah. A man is looking for suggestions on how to reduce sediment in Foley catheter to reduce frequent blockage. He has a 20 French in at present, but this is the third change in 3 weeks. He's using acetic acid, 25% solution to irrigate twice a day. He also takes cranberry capsules daily. Any thoughts?
I would say it'd be nice to know what the sediment is, and then, you know, if they've ever done any analysis. I know you can do analysis of kidney stones and then kind of figure out, you know, is it calcium, you know, is it struvite,
Right.
what's causing it? So then you can kind of figure out where you go from there. You know, with some certain kidney stones, you know, lemonade actually
Right.
can help with that. So I would say hydration and, you know, seeing what's
it is.
causing it.
Yeah, I think hydration is probably something this patient's already doing because they're doing some smart things. But I think that might be a question deserving of specialty
urologist.
consideration. So see your urologist and talk about it.
I have had nursing home patient after nursing home patient who would have recurrent urinary tract infections. And I think this person probably has a low-grade chronic infection because of the catheter. Well, you know that he's living with a symbiotic relationship. I mean, it's not a dangerous infection. It might be just bacteria that's living there, and he's going to live with that. But if you can cut down the number with cranberry, the essence of cranberry, which is vitamin C, and that's a whale of a lot cheaper than these cranberry capsules. I would say take 1,000 of vitamin C 4 times a day. Try that for a week. And again, hydration is the key. A woman from Sioux Falls would like to know what are the reasons for monthly testosterone shots. And I've got female doctors responding.
Yeah.
Low libido.
Low libido, that's the reason why.
That, you know, the reason men come in asking about testosterone are libido or sexual dysfunction and energy. And I think expectations are maybe that testosterone as a cause of those symptoms is higher than it actually is. So I'm a little bit conservative when it comes to supplementing with testosterone.
Yeah.
We've seen studies over the past even 5 years that link supplemental testosterone to cardiovascular bad outcomes, heart attacks and the like. So I caution patients that it may not be a cure-all. The other things that can cause low testosterone besides just not having enough testosterone are untreated sleep apnea and being on opioid pain medications. So those are some common things that we see that could be a cause of low testosterone.
Get off the opioids if
Yes.
you're on.
Yes.
And another thing is obesity, because fat could store more estrogen.
Yeah.
So you can get your estrogen and testosterone balance off of, and there is a normal decrease in testosterone as a man ages.
No, we're talking. That can't be true.
You get menopause.
Menopause. Pausing. My thought is that guys don't want to lose that. And so as you get older and you notice that there's a waning of that unbelievable surge that happens when you're 20 or 24, you don't want to lose that. And of course that's the case. But I have to say that in my own mind, the very best treatment is an exercise program. Guys, just get exercising. Don't think a pill or a shot is going to make a difference. And to the woman who asked about it, you know, be understanding. Give that guy support.
And actually, there has been some use of testosterone in women for libido issues.
Yeah, I know it. I think there's some risks to it.
There's
And I
risks,
keep worrying about prostate cancer, but it's a pretty minimal deal. And to be honest with you, I've gone through phases where I measured people's testosterone, I treated people with testosterone shots. It's way better, cheaper than all of the other methods. And then I didn't do it for a while because of the risks. And then I started again because it's such a dominant problem. So, as a male doctor who's old, I've gone through my phases have changed. And I'm at this point, what I am is very conservative, but still treating some people when their testosterone levels are low. But I always give them that exercise talk. Can you compare the cost of Aliquist, Prodoxa, Xarelto or warfarin?
So I recently had a patient who was diagnosed before I ever met her with atrial fibrillation, which is a reason to be on one of those blood thinning medications. She had been prescribed by her cardiologist Eliquis off the bat and had never known that she had other options. And she called me in February after I think her insurance changed on January 1st saying, "This pill costs me $200 a month out of pocket. Is there anything else I can take?" She didn't realize that there were other options. Warfarin or Coumadin is sort of the old standby, inexpensive, tried and true blood thinner. And so I personally have a lot more experience with that, even in my limited experience. And so usually stick to that first and foremost just because of cost. As far as how Eliquis compares to the other new anticoagulants or new blood thinners, I don't have great knowledge, and it probably depends on where you get the drug and your insurance coverage.
Yes, and a lot of the companies, if you're not on Medicare, Medicaid, or VA, usually TRICARE, you can get coupons or vouchers from the website or directly from the companies, and I've had people have varying success of them being redeemed and being honored. But definitely, warfarin is the one that has a reversal agent, vitamin K. The other ones don't.
There's one that's kind of starting,
border,
but
yeah.
we
That
don't.
exists, but probably most hospitals
Won't
carry
have it
yet.
here. I mean, you'd have to be at Mayo.
My thought is this, that there's probably no more dangerous pill that we prescribe than a blood thinner. I mean, I've had people bleed terribly from warfarin. I mean, they fall downstairs and then they're just all bruised. I mean, there's danger with that pill. And if you think about it, something like only 60% of people are compliant with the pills that we provide. I mean, they skip them or they don't feel well. And I mean, take it from a guy who's had to take a bunch of pills. I've never had to in my life, and now I'm in this. Here's what I think. Since compliance is so poor, there's only one drug of all those that I monitor carefully, and I know if they're on it or not. I go with no question about it. Warfarin's the better drug, I think, because I really do monitor them, and I think that's important.
Yes, and the name comes from my alma mater.
What's that?
Wisconsin Alumni Research Foundation. That's the Warf in warfarin.
No kidding.
idea.
I didn't know that.
It was, discovered and created at University of Wisconsin-Madison's med school.
What is it from? It was from the bladder or from the small intestine, or what? Do you remember the original warfarin? There's lung tissue. That's what it is. It's lung tissue. It was sheep lung tissue. Look it up. We often talk about the flu bug here on the program, but there are also other bugs that we need to know about.
The bothersome and harmful insects. Well, it sort of depends on what you mean by bothersome. Since we have people that are both highly tolerant of critters flying around and landing on them, as well as people that are highly paranoid about it, sometimes it's a little hard to determine what's bothersome. But if we leave it at the level of harmful, in some way, such as stinging or biting or piercing, then this time of the year we're still doing pretty well, but as spring progresses, moves into summer, then we will start picking up biting flies, particularly, such as black flies, which are also called buffalo gnats, no-see-ums, which are also called punkies, which are smaller versions of black flies, and we'll also move into mosquito season. Technically, mosquitoes are already active, but the really pesky ones won't be coming out for about another month or so yet in any abundance. So we'll go through a progression. Now, they're not insects, but we already have ticks out and about. And so that's something else that, in terms of the small critter issue, that's something else to be watching for, and they'll be active all the way through spring and summer. So oftentimes what the best thing to do is to actually surround yourself with burning items. One of the things my wife and I like to do during the summer, especially on a clear night, so we can watch the stars, is sit out on the deck. Have your drink and watch the stars and that sort of thing. But we live near a stream, and so there's mosquitoes that are out during the evening. And so we do just that. We ring ourselves with citronella candles so that that smoke wafts around us, and we put some high on the railings, and we put some down low so that you have some smoke swirling around your legs as well as coming up higher. Basically, nothing has changed. You use mosquito repellents, you keep covered. If you're trying to avoid some of the diseases that's spread, such as West Nile virus, try to stay indoors during the peak mosquito activity, which is early evening, especially later in the summer when the birds are starting to leave their nests and migrate, and that's about the same time the mosquitoes are becoming much more abundant and shift from the birds to people for feeding on.
Thank you, Dr. Johnson. He's a wonderful expert, and I've leaned on him a bunch. What do you think is the biggest threat as far as an insect goes in this part of the country?
Well, if you ask my husband, it's a bee, because you watch him do the bee dance whenever there's one around him, and
He's allergic.
yeah. So
So
then
to
you have
him,
worry
it's
about- it's a big deal.
Life-threatening.
Yeah.
And you have
EpiPens and-
EpiPens nearby and everything like that.
That takes care of it. So if you're allergic, that can
Yes.
be a very big threat.
Yeah. What do you think?
I would say probably the mosquito. You know, we see West Nile virus and most people get mild illness, but I think we've all seen a case of severe West Nile in an elderly person that can actually result in paralysis and being on a mechanical ventilator and those kinds of things. So use your DEET.
Yeah. Use your D. And particularly, as he said, during the early evening hours when the sun is setting, they come out.
And it's such a wonderful time to be outside otherwise. So.
But they go away after that. But I spray, and I put it on the kids because I mean, I don't have little kids right now. My little kids are 23 up to 34. So,
Yeah.
but I see that we've looked at the price of Eliquis is $518 for 60 tabs. That's 2 months. And Pradaxa is $385 for 60 tabs, and we don't have Xarelto yet, but that might be the one that's the one that's mostly used is Xarelto. An individual from Platt would like to know, what over-the-counter medicine would you recommend for arthritis?
Well, I was often told when there's a lot of things for one category,
There's no good.
none of them work very well. So you kind of have to see which one works for you. Naproxen is a nice one. I like it because it's twice-a-day dosing. Tylenol you have to be careful with because you can hit that maximum day dosing of 4 grams pretty easily. If you're taking 2
lot
extra
of
strength 4 times a day, you can hit that maximum. And even as you get older, we try to cut back to 3,000
Yeah.
milligrams a day. And then ibuprofen can get hard on the stomach, cause GI bleed. So there's pros and cons to everything.
Yeah.
Yeah. I think as far as what's most effective for arthritis pain, probably the anti-inflammatories have the best evidence, and that'd be like ibuprofen and naproxen over the counter. But you got to know if you're one of those people who shouldn't take those drugs. So if you've had an ulcer in your stomach, if you have kidney disease, if you have several other,
High
a
blood
lot
pressure.
a lot of people would say if you have coronary artery disease or heart problems, those are kind of off limits. In which case you have to go with the acetaminophen or Tylenol.
But I like to say to people, okay, on occasion, but not on a regular basis. I used to promote on a regular basis naproxen. I mean, I've changed my tune on that. It just burns holes in stomachs, and I've caused terrible bleeding problems from people. I mean, if you're an old enough doctor and you, back in the days when we were promoting these things, we had free samples. I just gave out all sorts of free samples and caused problems. Xarelto, $815 for 60 tabs, the most expensive of the 3. I kind of like topical Aspercreme, and you can also get a prescription.
Diclofenac or Voltaren gel, which I do a lot of.
I think that's a reasonable choice. There is a compound pharmacy in Sioux Falls that if you use that compound pharmacy, the prices are much more reasonable for compound, topical Voltaren and that type of diclofenac, that type of a thing. They'll take that generic, they'll mix it for you. And so I like that compound pharmacy in Sioux Falls. Not to say we shouldn't use our local pharmacy. What is Orph? The CDC says it's a virus transmitted from infected animal or human causing a pox-like lesion. Now, have you seen Orph? Have you seen Orph?
Can't say that I have.
I had that question one time before on an Ask Anything about 7 or 8 years ago. And it is a pox-like single lesion that's very open and very sore, and it's a virus infection. And I don't know what to say about the treatment except to say that it'll go away. I don't think we have. It's a viral. It is my experience that when one is dismissed from surgery, this is a question, with a need for pain medicine, the first choice is oxy, even for a little lady. Why not something lighter, like hydrocodone instead of oxycodone? What about narcotics for pain relief post-surgery?
You have to worry about causing constipation, and if you've had bowel surgery, you don't really want to be straining at that time. So there are things that you do need to be careful and cognizant about when using opiates. They do have their time and place, but doesn't say you necessarily need to take them just because they've been prescribed. You can start out with Tylenol, ibuprofen, see how you deal with that. I mean,
I love that answer. That's exactly the right answer. And you know what? I see people coming in, I've got a whole bottle of that stuff. I never used it.
Yeah. I mean, on the flip side, we see folks who end up having problems with opioid dependence and chronic pain syndromes, and where they started was in a post-operative prescription.
Yeah.
And I have seen some surgeons recently do a good job of using less strong things than oxycodone, even along that spectrum, maybe hydrocodone or tramadol as a first line. So I think people are becoming more cognizant of it, but it's something that we see the ramifications of every day.
Yes. And we took some time with that because it's a very important point. A man from Mower has foot pain in the balls of his feet. X-rays are normal. What else could it be? Quick answers.
it could be a Morton's neuroma. So there is a nerve that passes between basically where the big toe is and the second toe, or sometimes between the second and third toe. And it's just this little bundle of nerves that can get irritated, and people will describe it saying, God, it feels like there's a pebble in my shoe. I'm stepping on something. And that's usually what's going on there.
Perfect answer, Morton's neuroma. And so what do? You inject it with a little steroid, or you just...
I tell people, Dr. Haynes is a fabulous podiatrist, and you should go meet him.
We have a great podiatrist here. We do. A woman from Hot Springs asks, I have knee problems. It seems to be bursitis. What exactly can exercise help this?
So yes, I would say for any orthopedic complaint, exercise can help. And part of that is because anytime your joints have inflammation, which bursitis is a type of inflammation and the bursa of a joint, the more weight you're carrying on those joints, the harder it is on those. Okay. So, pool activity can be nice for folks, especially with knee problems, because it takes a little pressure off of that.
The studies, bone on bone, the exercisers do better than the couch potatoes. I am a blood thinner, clopidogrel, and I'm wondering if it's safe to take atorvastatin, a statin.
Is it safe? Yeah, atorvastatin should not interact in a negative way with those medications.
Clopidogrel. Okay. A man from Sioux Falls is diagnosed with arrhythmia and prescribed a beta blocker. What do beta blockers do, and how do they help? What is beta? It's blocking the beta. What is the beta?
So
beta refers to, it's essentially adrenaline or epinephrine in your system. That stimulates the heart to beat every time, and so there's beta receptors in the heart. When we block them with medications, it slows the heart rate, and they can have other effects, but that's the main one that we think of, especially in the setting of arrhythmia. And
they're wonderful drugs, but they cause people to slow down. It takes away the adrenaline kick. They get tired. Sometimes if you have a rhythm problem, they get too slow.
It's a banned substance on the PGA Tour because it keeps people a little more calm.
Yeah, it
Yeah,
takes
so-
away that
yeah,
adrenaline
exactly.
kick. The PGA.
Yeah,
Wow, that's interesting. My sinuses are clear during the day, but plug at night. How can I prevent this? Plugging at night. You think that's vascular?
I mean, there definitely can be some vascular with lying down, and then all the vessels kind of dilate. Kidneys don't have to work so hard to filter because blood isn't being pumped way up to the head against gravity. Also,
Could they be an allergic thing in their bedroom?
environmental,
thing,
like
yeah.
dust mites, you know,
Dust mites in
the
the bed.
pillows or the bed.
You're sleeping next to an open window. Oftentimes, we all do that. I do that. I mean, I love the open window, but the problem is, if you are allergic, that's the worst time. You know, that you're trying to sleep. There could be. I think there are positional things that happen with congestion. You just try to lay down and give yourself a little time. I think what happens, I find that I feel like I'm wheezing and tight, and I lay down long. If I forget about it and read a book, then my lungs open up. There's something about position changes. A woman had a surgery a couple years ago. They could not get the breathing tube down her throat, so they had to use a glide scope instead. What causes this problem? Sometimes she has trouble swallowing. Can anything be done? Ooh, that's an interesting.
That's a multi question. The first part, everyone has different anatomy, and when you're looking at the throat, there is what's called the epiglottis, and that's what covers your windpipe when you're swallowing, because we don't want food to go down into our windpipe.
Right.
So when you're looking at people, that windpipe is in the front here, and then your epiglottis covers it, and you have to, when someone's laying down flat, it's really hard to look down into that slot. So the glide scope is actually, I think, should be used almost in all of them. It makes it so much easier because you have a beautiful picture, a camera zooming in of exactly where you're going, so it minimizes trauma. So, the fact that she had a glide scope is actually probably a good
And
thing.
it's probably not related to her existing problem. We've got 2 minutes or less than 2 minutes and 5 questions. How do you treat diabetic neuritis?
Neuritis or neuropathy is a common problem with diabetes. We often treat it, we try to treat the diabetes as well as we can, and then we do have a lot of agents. First line is usually gabapentin is what most of us use to calm down the nerve fibers that are overacting.
It's a tough question because it's a permanent kind of a progressive
It's a
problem.
very difficult problem.
There's a question about pancreatic cancer. We'll talk about that next week. A woman from Aberdeen had carpal tunnel surgery 8 months ago, but there's still pain and swelling. What else should she do? Go back to the doctor who worked on her.
Yeah.
Yes.
Yep.
Agreed.
1 minute. A woman from Rapid City swim in at the Y, picked up a fungus on her nails. How does she get rid of it? Hard question.
It's hard to get rid of. So you have topical treatments that I should always encourage people to try. There are antifungal pills that you can take. They're
Very
not
expensive.
they're not 100% effective, and they can affect the liver. So it's a hard. Those nail funguses are difficult to treat.
Soak your fingers in vinegar for 10 minutes.
Vinegar, 10 minutes. Do that twice a week. Vinegar, 1-to-1 water. My husband is borderline diabetic. Which drug is better? Invokana or Trulicity? I've heard Invokana has negative side effects. How much time do we have? 20 seconds. What is the best drug for diabetic? It's an individual question.
Metformin, old tried and true drug,
And then
is
after
the
that?
best first line drug.
American Diabetes Association says you can go to any of the other classes.
After
so
that. Yep, okay. And I like Trulicity as a long chance, but a couple of these that are like it. Okay. And now for the winner of tonight's Prairie Doc quiz question. What is more dangerous, smoking cigarettes, eating lots of butter and bacon, heavy drinking of alcohol, avoiding vaccinations? And I asked you two, and you both said vaccinations or smoking, one of the two, and the answer is right, it's one of the two. We had great debates about this. It was Lauren Scott from Howard, South Dakota, who answered the question correctly. Thank you, Lauren, for participating. And a book will be in the mail to you soon. We'll be right back after this.
All around town, from stores to playgrounds, babies are on the move. And there are diseases that are on the move too. And some of these spread easily. To best protect him from 14 serious diseases by the time he turns 2 years old, vaccinate him according to the recommended schedule. So he can go on about his business and you can have peace of mind. For more reasons to vaccinate, talk to your child's doctor or go to cdc.gov/vaccines.
As a teenager, like many others, I yearned for independence and resisted my parents' rules and restrictions. Now I realize my parents struggled with how much freedom to allow me while best guiding me into adulthood. It's an old story. Kids want freedom. Parents are reluctant to give up control. Think back when you first obtained a driver's license and borrowed the family car. Remember, after some error in judgment or indiscretion, how the car privilege was taken away, and even when justified, how devastating that was. Now the tables may be turned, and the aging parent is threatened or devastated by losing the car privilege after some error in judgment or just because of advanced age. As a geriatrician, I have heard too many adult children ask me to tell their parents to stop driving. To the adult child, this is protecting his dad. To the elderly person, this is a double blow, losing the car privilege feeling of independence and the freedom to be mobile. Think about it. Who's more dangerous on the road? An 18 to 20-year-old male in a muscle car? A 16-year-old female with a cell phone? Or grandma? There are 3 lessons here. First, elderly persons who are competent should be allowed to make their own choice when to stop driving. In my years of practice, I have advised many competent elderly people, if you think you might be putting others or yourself at risk, then you decide when to stop or cut back on driving. When night vision is poor, neck flexibility is reduced, reflexes are slow, hearing is poor, posture is bad, then think about it. If you can't decide, or this is a borderline question, consider a driver improvement course for seniors through the American Automobile Association, AAA, and test yourself. Then you make that choice. The second lesson, elderly persons who are not competent need not to drive. When their learn a new thing memory is poor, and when accidents start piling up, then it's time for someone to step in. The elderly person first needs to see the doctor for evaluation. Afterwards, if declared incompetent, it means no driving, or will making, or check writing, or consenting to an operation. The third lesson is for everyone and every family to realize how important is the freedom to drive, especially for individuals trying to grow up with independence or age with dignity. We should all recognize what a precious freedom and right it is to drive. A big thank you to our guests, Kelly Evans and Jill Kruse. They are wonderful friends and the best colleagues anyone could have. Thank you so much.
Thanks for having us.
Here at On Call with the Prairie Doc, our staff and crew work to provide honest, science-based information aimed to help you make good healthcare decisions. If you believe in our efforts providing good information in a world of misinformation and would like to help continue this quest for trustworthy, real information, please go to prairiedoc.org and click on the donate button. Any help you can give will be put towards providing authentic information to thousands of viewers. Thank you. If you called or sent in a question that we didn't get to during the broadcast, well, we got to all of them. So, but every show will have a period of time after hours where we'll be posted on the website the following Monday, and there's a bunch of answers there. You might go there at prairiedoc.org and follow the links. Well, that does it for tonight. From all of us here at On Call with the Prairie Doc, until next time, next week's show, the last show of the season that's live, stay healthy out there, people.
Sometimes who the patient is can be surprising. In Luke 4:23, Jesus said, "Physician, heal thyself." Aging and facing death, one physician's experience. Next time, On Call with the Prairie Doc.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On-Call Television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota, and the ongoing support of these individuals and institutions. Brookings Health System, Ophthalmology Limited, South Dakota State Medical Association, Avera Heart Hospital, Dakota Allergy and Asthma, Fishback Financial Corporation, Vance Thompson Vision, Aberdeen Asthma and Allergy, Aberdeen District Medical Society, Black Hills Medical Society, Dakota Bank, Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, and Swiftel Communications.